Hello, my name is Roddy Lochala. I serve Unity Health as Chief Medical Officer. I'm also a family physician, and I wanted to discuss with you today some important developments in COVID-19, specifically a vaccine. There's been several questions brought to my attention in regard to the vaccine, how does it work, and different things like that. And so it was decided that I would do a video just to try to walk everybody through what we know right now and kind of where we are. First is made this model of COVID-19. You've seen that in all the pictures and videos. Well, the good part about the vaccines is that they've been developed relatively quickly. This is what's called an RNA vaccine. It is just a recipe to make, and I've made a model of a spike protein. So this vaccine is just a recipe to make this spike protein. What it does is that it only codes for this spike protein, not the virus. It is not an inactivated virus. It's not a dead virus. There's no virus at all in the vaccine. It's only the recipe to make a spike protein. And what happens is when you make the spike protein, we're asking your body to recognize this as foreign. And when it sees this as foreign, it will make an antibody to it and it will neutralize. It will see the spike as foreign and it'll develop an antibody. Well, that's important because in the future, when your body sees the real virus, it will have made antibodies and you'll have something that looks kind of like this. You'll make your own antibodies to the virus, and this virus doesn't have the ability to hurt you. So that's the theory behind the vaccines as we are right now. There's two of them. One is made by Pfizer, another by Moderna. They have both now applied for an emergency use authorization for COVID-19. So the next question is, well, what exactly is an emergency use authorization? It is not an FDA approval. It's an emergency use authorization that says during a public health crisis, we think it's helpful, but it's not a process that has taken years and years to develop and multiples of thousands of patients. So what they did was, even with these studies, they determined that they were safe and effective, and then they with much smaller amounts of people, but so 30,000 people, 40,000 people, not hundreds of thousands of people. And what they did is half the members of the trial got the real medicine, the other half got a placebo. And they waited until 170 people got COVID-19 and they unblinded the study. And when they did, they showed that 162 of the 170 actually had the placebo, and only 8 people that took the real vaccine got sick. And that's where they're getting that number of 90+% effective. And the Moderna vaccine showed a very similar efficacy. So that's important when we're talking about the vaccines. You need to know that it's an emergency use authorization. It's not a full FDA approval. Additionally, the Mayo Clinic has an independent group of doctors and researchers that are looking at this problem, and they are looking at the data as well, just to ensure that it has been above reproach, that everything is legitimate and safe to take these vaccines. And for the purpose of this video, I'm only talking about the Pfizer vaccine and the Moderna vaccine. These are both similar vaccines in that they're a messenger RNA vaccine, and we expect to get these first. We expect these to be the ones that we'll initially get. We've received the question of do we have a choice of which vaccine we'll get? Probably not at first. We expect to get the Pfizer vaccine initially, and hopefully after that we'll get a Moderna vaccine. We don't know how much or if or when we'll get either one of them. We're hopeful that we will, but we don't know for sure. There's questions about whether or not these can be taken during pregnancy. We're going to have to wait for the emergency use authorization and the fact sheet and all the data to come out to give us this. I don't know that it's been studied in pregnant patients, so I don't know the answer to that question. And we're going to find that that's really, you're asking very good questions, and right now we just don't know the answers to all of them. Another question is how often are we going to need to take the vaccine? Both the Pfizer and the Moderna vaccines require 2 injections. They're going to be either 21 or at least 21 or 28 days apart, so it will require 2 injections. We get a common question about side effects, and I think that's very appropriate to ask. The side effect of the vaccine so far have been very mild. Patients have had fatigue, headache, some muscle soreness, and injection site pain, much like what you get with a flu shot. Again, there's about 30,000 people that received these different injections, so it's not hundreds of thousands, but it has been tolerated, but we all need to know that it's very possible that we may have some headache or fatigue with these vaccines. Lastly, we want to know how long these vaccines will last. And the answer to that question is, I don't think anybody knows right now. The pandemic's only been here a year, and they've been studying these vaccines and how your body responds to it. It may be that we get this vaccine every 6 months, maybe it's a year. We just don't know right now. But we do have the good news of this vaccine. And it's important that we all think about taking this immunization, because this is how we're going to stop the pandemic and get life back to what we call normal. We are going to be asking people to take the vaccine. We're, of course, not going to force or coerce anyone to do it. But I want each one of you to make a decision about the vaccine based on scientific fact and risk. For example, myself, I want to take the vaccine to help protect my parents. If I get COVID-19 and I'm part of the people that's completely asymptomatic and have it, I do not want to give COVID-19 to my parents. So if me taking this immunization helps protect my parents, then I want to do that. And I want you to give every consideration to taking the vaccine, and also know that it's been well studied, or it's studied as much as possible to give us some relief in COVID-19. Again, thank you for everything you do for Unity Health, and I will present more information as it becomes available.